Today, I'm gonna talk about the art therapy and sexual health. I will divide it into four parts: the definition and importance of sexual health, the application of art therapy in dealing with sexual health problems, practical application cases, and specific techniques and methods. As we all know that sexual health is a multidimensional concept that addresses the physical, mental, and social well-being associated with sexual behavior, gender identity, and relationships. According to the World Health Organization, sexual health is not just the absence of disease or dysfunction, but also includes positive, pleasurable, and safe, with respect for and protection of the sexual rights of all people. Physical health means normal functioning and disease-free state of the sexual organs and reproductive system. Mental health means a positive and healthy attitude towards sexual behavior, gender identity, and relationships without anxiety, depression, or psychological disorder related to sex. Social health means self-esteem, confidence, and a sense of security in sexual and sexual relations, and the ability to freely choose behavior without force, discrimination, or violence. Sexual rights means including the rights to sexual autonomy, access to sexual education and contraception, and the right to be free from sexual violence and assault. The importance of sexual health means sexual health has a profound impact on both individuals and societies. Personal health and well-being. For example, physical health, the maintaining sexual health can prevent and reduce reproductive health problems such as sexually transmitted infections and infertility. Safe and enjoyable sex contributes to overall physical health. Healthy sexual attitudes and behaviors can enhance an individual's mental health and reduce negative emotions such as anxiety, depression, and low self-esteem caused by sexual problems. Good sexual health contributes to life satisfaction and happiness. Healthy sexual relationships are also built on respect, trust, and open communication, and contribute to the stability and satisfaction of intimate relationships. Sexual health also promotes emotional connection and intimacy between a couple or partner. The social and economic impact, for example, sexual health education and surveys help reduce the incidence of sexually transmitted infections and unwanted pregnancy, thereby reducing the public health burden and health care costs. Sexual health education and services can promote the realization of gender equality and sexual rights, reduce discrimination and violence based on gender or sexuality, and promote social harmony and equality. Improving the sexual health reduces productivity losses and healthcare costs associated with sexual health problems, and increases the economic stability of individuals and families. About the youth and education. Systematic and comprehensive sex education can help adolescents properly understand and respond to sexual issues, develop healthy sexual attitudes and behaviors, and prevent early pregnancy and sexually transmitted infections. Sex education not only helps adolescents to understand physical changes and sexual health, but also supported them to build a positive gender identity and self-esteem, thereby promoting mental health and personality development. About the sexual health of special populations, for example, the LGBTQ, ensure the sexual health and rights of them, provides non-discriminatory and inclusive medical and psychological services, and support their mental health and social inclusion. For all adults, the sexual health of them is often overlooked, but remains an important part of their overall health and quality of life. Respecting and supporting the sexual health needs of all persons contributes to their physical and mental health and well-being. The art therapy is a therapeutic approach that promotes an individual's emotional, mental, and social well-being through creative artistic process. It uses the visual arts as a tool for expression and communication, with significant effects on dealing with sexual health issues such as sexual trauma, gender confusion, and sexual dysfunction. The sexual trauma refers to the psychological and emotional trauma caused by experiences of sexual violence, abuse, or other sexual assault. Art therapy provides a safe space for nonverbal expression, allowing trauma survivors to express feelings and experiences that are difficult to describe in words through painting, sculpture, or other art forms. This helps reduce fear and pressures to express. By creating works of art, individuals can externalize their inner pain and trauma in order to better face and deal with these emotions. Visualizing traumatic experience can help survivors understand and process their experience. A sense of autonomy and control in the process of making art can help trauma survivors regain a sense of control over their lives, boosting self-esteem and self-confidence. Art therapy allows individuals to process and express emotions at their own pace, thereby gradually reducing the psychological burden of trauma. The gender confusion refers to confusions or uncertainty about an individual's gender identity or gender expressions. Self-exploration means the artistic creation provides the individuals with a safe way to explore and express their sexual identity. Through the artwork, individuals can explore different gender roles and expressions, helping them to better understand their gender identity. In art therapy, the therapist can provide emotional support and understanding by interpreting the artwork to help the individuals accept and identify with their gender identity. Art therapy allows individuals to express their gender identity and feelings in visual and creative ways, thereby enhancing the freedom of self identification and gender expression. In group art therapy, Individuals can communicate with and share with others who have similar experience, enhance social support and a sense of belonging. Okay, the next one, let's talk about the sexual dysfunction. This one includes the various physical or psychological problems that affect sexual behavior and satisfaction, such as the low libido or the premature things. So, for this one, we have some of the ways to resolve it. Through the artistic creation, people can relax and reduce anxiety and stress related to sexual functioning. The art activity itself has a decompression and relaxation effect, which helps to relieve the tension caused by sexual dysfunction. Self-expressions can help them to express their feelings and distress about sexual dysfunction through artworks, which helps them understand and accept their conditions. Thus, they can also reducing the psychological burden. The therapeutic communication can provide a new way of communication between the therapist and the patient. And by discussing the artwork, the therapist can gain a deeper understanding of the patient's emotional and psychological states so as to develop a more effective treatment plan. The body awareness, which means the physical activity and the creative process in art therapy, can help individuals increase their awareness and perception of their bodies, improve their sense of body identity and self-confidence, and thus promote the recovery of sexual functions. Next, I will introduce several different cases. The first one is an individual therapy for dealing with sexual trauma. A sexual trauma survivor paints his own traumatic experiences through art therapy. He guided by a therapist, and then he gradually externalized and understood these experiences through the art therapy, which means the painting process. The process can help her ease the anxiety and fear triggered by the trauma because through the process he can gradually paint what he feels fear, and then the therapist can help him to gradually understand why he will draw these things and why he can feel. So after that, through the repeated art therapy, he regained a sense of control of his life, became more emotionally stable, and gradually stepped out of the shadow of trauma. The next one is about the supporting gender confused teens. A teenager who has confused about her gender identity explores her feelings and identity about her gender through painting and sculpture in art therapy. In the process, he was able to freely express his confusions and emotions. Through the process, he can do something when he feels confusions. For example, like the sculpture, some artists, when they make their work, they will like their work will more like themselves. So, when the teenager tries to build something with the sculpture, he will realize that the artwork in his hand is become himself. So, after the therapist helped him to understand and accept his gender identity, increase his self-confidence, and with the support of the therapist, gradually establish a positive gender identity. The last one is a group therapy to improve sexual dysfunction. A group of men with sexual dysfunction express their feelings and impacts on sexual dysfunction through co-creation and sharing of works in art therapy. After a few times of the group art therapy, this type of group art therapy can enhance support and understand among of members and reduce their psychological stress. They can talk to each other and feel others' expression. And some members showed significant improvement in subsequent sex therapy. Okay, now let's talk about the art therapy ways. Art therapy uses a variety of art forms and techniques to help individuals express and deal with sexual health issues such as sexual trauma, gender confusions, and sexual dysfunction. For example, drawing is one of the most commonly used methods in art therapy, helping individuals externalize and deal with their inner emotions and problems through the free expression of color, line, and image. Free painting means individuals are free to create without specific guidance, can express their feelings and ideas, especially suitable for dealing with sexual trauma and emotional confusions. The therapist provides the individuals with a theme such as my gender identity or traumatic experience and guide the individuals to create around that theme, help them to explore and deal with a particular issue more purposefully. Also, we have the picture-in-picture way. The individual first draws an emotion or problem and then adds or modifying it on the basis of it and gradually adjust the word to help the individuals gradually understand and solve the problems. The sculpture uses the clay, plaster, or other materials to help individuals express and deal with emotional and psychological issues through three-dimensional creations. Individuals make the status of themselves that express self-image and identity, especially suitable for dealing with gender confusion and self-identity issues. Trauma sculpture creation traumatic experience is concretized, helping individuals externalize and understand the trauma, and gradually reducing the psychological burden brought by trauma. The character sculpture can help the individuals to create sculptures that represent different gender roles or sexual health issues as a way to explore and understand different roles and issues. The dance and movement therapy helps the individuals to express and deal with emotional and psychological problems through the physical movement and dance. We have the free dancing, situational dancing, interactive dancing, and this dancing is totally same but also different. The individuals dance freely with the accompaniment of music to express their inner emotions and energy, especially suitable for dealing with sexual dysfunction and emotional reflection. And in the group therapy, the individuals dance through interaction with others to enhance emotional connection and support, which is particularly suitable for dealing with social disorder or gender confusion. Also, we have the music therapy. This one is uses the process of music creation and experience to help individuals express and deal with emotional and psychological issues. We have the improvisation and music listening, and also we have the songwriting. But sometimes the music therapy is mostly focusing on the music listening because when people listen to specific music and then share and discuss their feelings and association after listening to it, helping them can externalize and deal with their inner emotions and problems. But about the songwriting, it's quite difficult to some of people that are not good at singing. And the last one is the writing and poetry therapy. This one can help individuals to express and deal with the emotional and psychological problems. But for this one, it's probably not easy for everyone. But we also have the free writing and the thematic poetry and dialogue writing. Maybe the dialogue writing is more suitable for everyone because individuals explore and express inner conflicts and problems through writing conversation with themselves or others is more easily, and this one is especially suitable for dealing with sexual dysfunction and emotional communication problems. And that is it. Thank you for watching. I will continue to share the details of gender identity and art therapy in the next chapter.